Biofeedback therapy, unlocking control over involuntary body functions. As you extend your hand in a friendly wave or lift your knee during a workout, you are consciously directing these actions. Yet, numerous bodily functions, such as heart rate, skin temperature, and blood pressure, operate involuntarily under the control of your nervous system. The beating of your heart, for instance, is not a result of conscious thought but a reaction to environmental factors like excitement, nervousness, or physical exertion. Biofeedback, a therapeutic technique, offers a pathway to gain more influence over these typically involuntary functions. Its applications range from preventing to treating conditions such as migraine headaches, chronic pain, incontinence, and high blood pressure. Understanding the mechanism of biofeedback therapy. The precise mechanisms underlying the efficacy of biofeedback remain elusive to researchers. However, it is established that biofeedback contributes to relaxation, a factor integral to alleviating conditions associated with stress. In a biofeedback session, electrodes or finger sensors are affixed to the skin, transmitting signals to a monitor. This monitor, in turn, displays visual or auditory representations of physiological parameters like heart rate, breathing rate, blood pressure, skin temperature, sweating, or muscle activity. Stress induces changes in these functions. Heart rate accelerates, muscles tense, blood pressure rises, sweating ensues, and breathing quickens. Observing these stress responses in real time on the monitor provides immediate feedback, enabling individuals to attempt to intervene. Although biofeedback sessions are typically conducted in a therapist's office, computer programs exist that connect biofeedback sensors to personal computers. Guided by a biofeedback therapist, individuals practice relaxation exercises tailored to regulate various bodily functions. For example, a relaxation technique might be employed to mitigate the brainwave activity associated with headaches. Diverse relaxation exercises are integrated into biofeedback therapy, encompassing deep breathing, progressive muscle relaxation, alternating between tension and relaxation of different muscle groups, guided imagery, concentrating on a specific image to enhance relaxation, mindfulness meditation, focusing thoughts and relinquishing negative emotions. As individuals succeed in slowing their heart rate, reducing blood pressure, and alleviating muscle tension, the monitor provides instant feedback. Over time, individuals learn to autonomously control these functions without the aid of biofeedback equipment. Various biofeedback types monitor distinct bodily functions. Electromyogram, EMG, measures muscle activity and tension, applicable to back pain, headaches, anxiety disorders, muscle retraining after injury, and incontinence. Thermal, measures skin temperature, beneficial for headache and Raynaud's disease. Neurofeedback or electroencephalography, EEG, measures brain waves, employed in attention deficit hyperactivity disorder, ADHD, epilepsy, and other seizure disorders. Electrodermal activity, EDA, measures sweating, useful for pain and anxiety. Heart rate variability, HRA, measures heart rate, employed in anxiety, asthma, chronic obstructive pulmonary disease, COPD, and irregular heartbeat. A typical biofeedback therapy session spans 60 to 90 minutes, with noticeable benefits often emerging within 10 sessions. Certain conditions, such as high blood pressure, may necessitate additional sessions for improvement. Diverse applications of biofeedback. Biofeedback demonstrates efficacy across a spectrum of conditions. Here are some notable biofeedback benefits. Chronic pain. By identifying tense muscles and subsequently learning to relax them, biofeedback may alleviate discomfort associated with conditions like low back pain, abdominal pain, temporomandibular joint disorders, TMJ, and fibromyalgia. It proves beneficial for pain relief across all age groups. Headaches. Biofeedback is extensively studied for headache relief. Muscle tension and stress can trigger migraines and exacerbate other headache types. Substantial evidence supports the use of biofeedback therapy to relax muscles, mitigate stress, and reduce the frequency and severity of headaches. Combining biofeedback with medications enhances its efficacy for headaches. Anxiety. Biofeedback is commonly employed for anxiety relief, fostering heightened awareness of the body's stress responses and empowering individuals to regulate these responses effectively. Urinary incontinence. Biofeedback aids individuals struggling with urinary incontinence by facilitating the identification and strengthening of pelvic floor muscles that control bladder emptying. After several sessions, Individuals may experience a reduction in urgent urination and fewer accidents. Biofeedback also proves beneficial for children with bedwetting and individuals with fecal incontinence. High blood pressure. While evidence on the effectiveness of biofeedback for high blood pressure is mixed, it does exhibit a modest blood pressure lowering effect. However, it is not as potent as medication for blood pressure control. Additional applications of biofeedback encompass attention deficit hyperactivity disorder, ADHD, chronic obstructive pulmonary disease, COPD, Raynaud's disease, injury, asthma, constipation, epilepsy, rheumatoid arthritis. Embarking on biofeedback therapy. Biofeedback therapy is offered by various healthcare providers, including psychiatrists, psychologists, and general physicians. To locate a qualified biofeedback provider in your vicinity, consider reaching out to organizations like the Association for Applied Psychophysiology and Biofeedback. Types of biofeedback modalities. Electromyogram, EMG. Technique. EMG biofeedback measures muscle activity and tension. Electrodes are placed on the skin over targeted muscles, and the electrical signals generated by muscle contractions are displayed on a monitor. Real-life example. Case study, chronic back pain. A patient with chronic back pain underwent EMG biofeedback to identify and manage muscle tension contributing to their discomfort. Through targeted exercises and feedback, the patient learned to relax specific muscle groups, leading to a significant reduction in pain over several sessions. Thermal biofeedback. Technique. Thermal biofeedback measures skin temperature. Sensors detect changes in skin temperature, providing information about blood flow and stress levels. Real-life example. Case study, Raynaud's disease. A patient diagnosed with Raynaud's disease, a condition affecting blood flow to extremities, used thermal biofeedback to increase peripheral blood circulation. By visualizing and regulating skin temperature, the patient experienced reduced episodes of numbness and tingling associated with the disease. Neurofeedback or electroencephalography, EEG. Technique. EEG biofeedback, also known as neurofeedback, measures brain waves. Electrodes are placed on the scalp to monitor electrical activity in the brain, promoting self-regulation. Real-life example. Case study, ADHD management. A child diagnosed with attention deficit hyperactivity disorder, ADHD, underwent neurofeedback training. By learning to modulate their brainwave patterns, the child demonstrated improved attention and impulse control, reducing the need for medication over time. Electrodermal activity, EDA. Technique. EDA biofeedback measures sweating or electrodermal responses. Electrodes attached to the skin monitor changes in skin conductance, providing insights into stress levels. Real-life example. Case study, anxiety management. A patient with generalized anxiety disorder utilized EDA biofeedback to identify triggers and manage stress responses. By developing strategies to control sweating and skin conductance, the patient reported decreased anxiety and improved overall well-being. Heart rate variability, HRA. Technique. HRA biofeedback measures the variability in the time intervals between heartbeats. It offers insights into autonomic nervous system function and emotional regulation. Real-life example. Case study, asthma management. A patient with asthma incorporated HRA biofeedback to enhance respiratory function and reduce the frequency of asthma attacks. By regulating heart rate variability, the patient experienced improved breathing patterns and better asthma control. Biofeedback and lifestyle. Biofeedback therapy can be significantly enhanced when integrated into a holistic approach to lifestyle. Adopting healthy habits related to diet, exercise, and sleep can complement the benefits of biofeedback, promoting overall well-being and optimizing the therapeutic outcomes. Here are some holistic tips for maintaining a health-focused lifestyle. 1. Nutritious diet. Balanced nutrition. Ensure a well-rounded diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Balanced nutrition provides essential nutrients for overall physical and mental health. Hydration. Stay adequately hydrated, as water plays a crucial role in maintaining physiological functions, including those monitored during biofeedback sessions. 2. Regular exercise. Aerobic activities. Engage in regular aerobic exercises, such as walking, jogging, or swimming, to support cardiovascular health. Regular physical activity complements biofeedback by promoting stress reduction and enhancing mood. Mindful movement. Incorporate mindful exercises like yoga or Tai Chi, which not only contribute to physical fitness, but also align with the relaxation principles emphasized in biofeedback. 3. Quality sleep. Sleep hygiene. Establish consistent sleep patterns and create a sleep-conducive environment. Quality sleep is vital for recovery and resilience, positively impacting the physiological parameters monitored in biofeedback sessions. Relaxation techniques. Practice relaxation exercises before bedtime, such as deep breathing or progressive muscle relaxation, to promote a calm and restful sleep. 4. Stress management. Mindfulness practices. Integrate mindfulness meditation into daily routines to cultivate awareness and reduce stress. Mindfulness complements the self-regulation skills developed through biofeedback. Time management. Effectively manage time to reduce feelings of overwhelm. Biofeedback, combined with efficient time management, can contribute to better stress coping mechanisms. 5. Social connections. Support networks. Foster positive social connections. Emotional well-being is closely linked to social support, and a strong support network can positively influence the outcomes of biofeedback therapy. Communication skills. Enhance communication skills to express emotions and build healthier relationships, contributing to a supportive environment for biofeedback progress. 6. Mind-body connection. Cognitive behavioral strategies. Incorporate cognitive behavioral techniques into daily life. These strategies align with the cognitive aspects addressed in biofeedback, promoting a harmonious mind-body connection. Visualization. Use guided imagery or visualization exercises to enhance positive thinking and reinforce the mind's influence on physiological responses. 7. Hygiene practices. Self-care rituals. Implement self-care rituals, such as regular grooming and hygiene practices. Maintaining personal hygiene contributes to an overall sense of well-being, reinforcing the mind-body connection. 8. Technology detox. Screen time management. Limit screen time, especially before bedtime. Excessive exposure to screens can impact sleep quality, and managing screen time aligns with the goal of optimizing biofeedback outcomes. Frequently asked questions, FAQ, about biofeedback therapy. 1. What is biofeedback therapy? Biofeedback therapy is a non-invasive technique that enables individuals to gain control over involuntary bodily functions. It involves monitoring physiological responses, such as heart rate and muscle tension, and providing real-time feedback to promote self-regulation. 2. How does biofeedback work? During a biofeedback session, sensors are attached to the skin to measure physiological parameters. The feedback, often visual or auditory, allows individuals to observe and regulate their responses. The therapy aims to enhance awareness and control over functions influenced by the autonomic nervous system. 3. What conditions can be treated with biofeedback? Biofeedback is used to address various conditions, including chronic pain, headaches, anxiety, urinary incontinence, and high blood pressure. It can also complement treatments for ADHD, asthma, and other health issues. 4. Are biofeedback sessions only conducted in a therapist's office? While traditional sessions occur in a therapist's office, there are also computer programs that connect biofeedback sensors to personal computers. This allows individuals to engage in biofeedback exercises in the comfort of their homes. 5. How long does a typical biofeedback session last? A standard biofeedback session typically spans 60 to 90 minutes. However, the frequency and duration can vary based on the individual's condition and progress. Noticeable benefits often emerge within 10 sessions, although some conditions may require more sessions. 6. Can biofeedback be combined with other forms of therapy or medication? Yes, biofeedback can be complementary to other therapeutic approaches and medications. Combining biofeedback with conventional treatments, such as medications for headaches or pain management, has been shown to enhance overall efficacy. 7. Is biofeedback suitable for children? Yes, biofeedback can be adapted for children, especially in cases of ADHD, bedwetting, or anxiety. Pediatric biofeedback is designed to be engaging and age-appropriate, helping children learn self-regulation skills. 8. How does biofeedback contribute to stress management? Biofeedback promotes relaxation by helping individuals recognize and control physiological responses to stress. Techniques such as deep breathing, progressive muscle relaxation, and mindfulness meditation, integrated into biofeedback therapy, contribute to effective stress management. 9. Is there scientific evidence supporting the effectiveness of biofeedback? Yes, there is substantial scientific evidence supporting the efficacy of biofeedback for various conditions. Numerous studies have demonstrated its effectiveness in pain management, headache reduction, and improving physiological functions. 10. How can I find a qualified biofeedback provider? Healthcare providers offering biofeedback therapy include psychiatrists, psychologists, and general physicians. Organizations like the Association for Applied Psychophysiology and Biofeedback can assist in locating qualified providers in your area. Conclusion. In the realm of healthcare and well-being, biofeedback therapy stands as a dynamic and versatile approach, offering individuals the key to unlocking control over their involuntary bodily functions. As we navigate the intricate dance between conscious actions and autonomic responses, biofeedback emerges as a guiding light, providing insights and tools for self-regulation. While the exact mechanisms driving the efficacy of biofeedback remain the subject of ongoing exploration, its tangible benefits in promoting relaxation and mitigating stress-related conditions are undeniable. Through the marriage of technology and mindfulness, biofeedback empowers individuals to observe, understand, and ultimately influence their physiological responses in real time. The diverse applications of biofeedback, from chronic pain management to anxiety relief and beyond, underscore its adaptability in addressing a spectrum of health challenges. The integration of various relaxation exercises, guided by dedicated biofeedback therapists, creates a tailored and holistic approach that extends beyond the therapy session into individuals' daily lives. Biofeedback's impact is not confined to the therapist's office. Advancements in technology allow for the extension of its benefits into the personal spaces of individuals. Whether in the hands of a skilled practitioner or through the use of home-based biofeedback devices, the journey towards enhanced well-being becomes a personal exploration, guided by the principles of self-awareness and self-regulation. As we reflect on the synergy between biofeedback therapy and lifestyle choices, it becomes evident that a comprehensive approach to health is rooted in balance. The incorporation of nutritious diets, regular exercise, quality sleep, and mindful practices complements the goals of biofeedback, creating a symbiotic relationship that fosters resilience and optimal functioning. In conclusion, biofeedback therapy serves not only as a treatment modality but as a journey of self-discovery and empowerment. The stories of individuals finding relief from pain, managing stress, and gaining mastery over their physiological responses echo the promise of biofeedback in enhancing the human experience. As we continue to unravel the mysteries of mind-body connections, biofeedback stands as a beacon, inviting individuals to reclaim agency over their health and embark on a path towards holistic well-being. Your health matters. Quali.health